Dear participants, welcome to my presentation. My presentation is a part of project titled Clinical Care for Electrical Stimulation in Physiotherapy and Rehabilitation. The project was funded by Erasmus Plus program of the European Union, and the project was and is leading by Pamukkale University and our partners University of Craiova, Hatay Mustafa Kemal Üniversitesi, Başkent Üniversitesi, Süleyman Demirel Üniversitesi, Şule State University of Applied Science, Burdur Mehmet Akif Ersoy Universities, and we have associated partners such as Turkish Physiotherapy Association, Order of Physiotherapists in Romania, Lithuanian, and Estonian associations are related partners. And in Module 4, electrical stimulation for the denervated muscles under this part of the project. We write the chapter before atrophy presence, the electrical stimulation for the denervated muscles before atrophy presence with Özden Gökçek from Ege University, Faculty of Health Science, Department of Physiotherapy, and me, Esra Doğru İsmini from Hatay Mustafa Kemal University. We write the chapter with Professor Özden. In peripheral nerve injuries, sensory and motor loss are seen due to structural damage to the nerve. Damaged axons cannot be completely regenerated after nerve injuries. Appropriate treatment selection is important to increase the growth rate of the nerve and reconnect the nerves in the injured area. To provide this reconnection, we have some methods, some surgical methods, and before and after these surgical methods, we have non-surgical treatments, especially methods that are included in physical therapy and rehabilitation. And electrical stimulation is one of these methods, and most used methods in rehabilitation is electrical stimulation in nerve injury, in denervation phase and in reinnervation phase. And for pharmacological treatments, to provide functional recovery of patients and to prevent the atrophy, to provide the regeneration, electrical stimulation is one key method in rehabilitation of these patients. And we apply electrical stimulation to restore the contraction property of the denervated muscles whose structure has changed because of denervation, muscle structure and morphology change a lot. So we apply electrical stimulation to protect the non-changed properties and to restore the changed properties of the denervated muscle. Electrical stimulation also promotes muscle reinnervation and reduces muscle atrophy by increasing the expression of structural protective proteins. And the studies reported that long pulse duration in electrical stimulation play a role in regeneration by preventing the degeneration process in muscle tissue. So long pulse duration of electrical stimulation is the one parameter that we should remember in electrical stimulation of degeneration. It has been that electrical stimulation can increase muscle mass by about 1% and improve muscle function about 10 to 15%. And there are studies that at the molecular levels that electrical stimulation provides anabolic catabolic balance and stimulates the regenerative capacity of satellite cells. The electrical stimulation has many positive effects on degenerated muscles in molecular level and in anatomical level. Physiological and biochemical changes in the denervated muscles. The denervation period is reported as a process which resulted in muscle atrophy but not degeneration. This suggests the muscles that had experienced a significant loss of size and strength due to lack of nerve supply. As you know, in the nerve injury, the muscle cannot take signals from the central system, and this causes a lack of nerve supply. And the literature reported that electrical stimulation lasting 30 minutes daily provides many positive effects in muscle mass and histological appearance. In a study, they reported that 30-minute daily stimulation protocol with a frequency of 20 to 25 Hz was effective in restoring muscle mass and histological appearance. So we should remember that long pulse and about 20-25 Hz frequency electrical stimulation are effective in denervated muscles. So we should remember these two parameters. Physiological and biochemical effects has the electrical stimulation. Innervation of skeletal muscles has significant effects on maintenance of physiological tone and function. After the denervation, atrophy and sometimes fibrosis occurs, and many molecular level change occurs. By electrical stimulation, we are trying to bring the muscles histological and anatomical normal. Yes, we said that electrical stimulation has positive effects on the nervated muscles. Then, which methods we can use to provide these positive effects of electrical stimulations? We have many methods in electrical stimulation, but we know that electrical stimulation must be in sufficient intensity and variable current. The surface of the membrane close to the cathode becomes negative, and the negative pole is the most effective pole, and increasing the resting potential difference across the north plasma membrane near the anode. Electrical stimulation is commonly used at about 10 to 30 minutes of galvanic or Faraday current, but it depends on the lesion type. Unidirectional and rectangular beats from 5 to 10 or from 30 to 300 milliseconds pulse duration per day, and 4 or more seconds between beats used in denervated muscles. Then we can say we have some methods such as galvanic or Faraday current, and we have waveforms such as rectangular beats to innervate the denervated muscles. Strange duration curve, or in other words, Reubas and Chronoxy, are the most used properties to determine the nerve injuries level. And as you see in the figure below, the stimulus duration and stimulus strength, we are giving stimulation until we saw the first contraction. When we saw the contraction, we call this reobas, and in two reobas, we that it comes to stimulus duration, we call it chronoxy. And for us, the stimulus amplitude and the duration is the most important things that we should know, and we should check while stimulation. And Reobas refers to the minimum stimulation that provides muscle contraction and it's measured by milliamperes. The chronox is the pulse duration at which the stimulation amplitude required to elicit a response is twice the reobas, and it's measured with milliseconds. We can give decision about nerve injury by this chronoxy. Measuring the nerve injuries level by Reobaz and chronoxy is very important. Kern et al. Conduct a study on denervated muscle stimulation, and they recommended and used the following stimulation parameters. Fast pulse duration 120, 150 milliseconds, pulse interval 300 to 500 milliseconds, frequency 1 to 2, on time 2 to 4 seconds, off time 1 to 2 seconds, and electrode type. They used large anatomically shaped electrodes with a size of 200 centimeter square, made of silicon graphite material. And then here I want to say that big anatomically shaped electrodes are better than small, such as small steel electrodes. The big electrodes are better because by the big electrodes, anatomically shaped electrodes, you can give stimulation to all fibers of the muscle. So using anatomically shaped and as big as the muscle electrodes is better to provide more stimulation to more fibers. Applying 2 times per day for 15 minutes each session at 3-minute pause is given after 5 minutes of stimulation to prevent muscle overstrain. We also should be careful about fatigue of the muscle. If you cause fatigue during the electrical stimulation, you don't provide the positive effects of electrical stimulation. Instead, you can cause tiredness and can cause negative effects of electrical stimulation in denervated muscles. So you should give pulses between the stimulation. And you can increase the stimulation up to 2 times per day in and 30 minutes each session. And using stimulation 25 to 30 milliseconds would not be effective because no sufficient contraction could be provided. So we should give stimulation as much as will provide muscle contraction. If you don't provide muscle contraction, your electrical stimulation doesn't mean anything, nonsense. And anatomically shaped electrodes are better than small electrodes. Yes, galvanic stimulation is the first electrical stimulation method that we remember that it comes to our mind in stimulation of denervated muscles. The galvanic current stimulation is preferred in conduction disorders because nerve damage give response to galvanic stimulation because it has a long pulse duration. And so the narrated muscles respond to galvanic current stimulation. Interrupted galvanic current, it means there are intermittent interruptions, can stimulate both innervated and denervated muscle fibers. Using long and rectangular direct current impulses can help elicit a response in both innervated and denervated muscle fibers. The galvanic current stimulation increases blood flow to the treated area. Galvanic current stimulation helps to minimize the formation of atrophy by enabling the muscle to contract similarly to the voluntary contraction and by providing the necessary oxygen and nutritional needs of the muscle with the effect of vasodilatation. And studies showed that the denervated muscle fibers are trainable While denervated muscle fibers may experience atrophy and reduced function, they can still exhibit some level of responsiveness and adaptability. So, even in long-term denervation, we may try electrical stimulation because the literature say that even long-term denervated muscles can give response to electrical stimulation and can adapt itself to electrical stimulation. And in galvanic stimulation, which parameters we are using? Mostly we are preferring 200 milliseconds stimulation duration, on time range 100 to 500 milliseconds, off time 2000 milliseconds. We are trying to make the off time longer than on time, not to cause tiredness in the muscles. And treatment frequency 3 times per week for 15 minutes each session is recommended. And electrode size, surface electrodes with size ranging from 20 to 50 centimeters square are used to achieve selective stimulation of paralyzed muscle tissue. And wave-form triangular pulses are commonly used for electrical stimulation of the denervated muscle. Triangular pulses with pulse duration of 200 milliseconds or 500 milliseconds are commonly used. And the cathode is more effective than the anode. So if we are using uh, monopolar technique, we should put the anode on motor point of the muscle. But if we are using polar techniques such as the figure, we may use oligoinsertio for bipolar techniques. And another current that we are using is Faraday stimulation. Faraday current stimulation has a pulse duration of 0.1 to 1 milliseconds, a frequency of 50 to 100 hertz, which is a fast but not instantaneous type of stimulation. After reinnervation in the denervated muscles, contraction is absorbed in the muscle with the use of the Faraday current. As a result of stimulation, it increases tolerance to muscle fatigue and prevents atrophy. For stimulation of the muscle in the partial denervation state, higher current intensity is required compared to the healthy muscle and the nerve. Surgery for stimulation is one of the methods that's used in denervated muscle stimulation. Surgery for radical stimulation is a type of Faraday stimulation, but it has source. And as you see in the figure, surgery means increase and decrease simultaneous. The stimulus are increases and decrease in the routine phase. The muscle stimulation, activation, and retraining of muscle movement is provided by surgery Faraday stimulation. And yes, the current density increase and decreases rhythmically. Yes, the word that I was searching in my mind is that increasing and decreasing the stimulation is rhythmically, as you see in the figure. Surge current is generally used in paralysis situations. The rate of increases and decreases in peak amplitude is slow. The surge can be adjusted as 2 to 5 seconds surge continuously or by selecting frequencies of 6 to 30 surge minute. The rest period given for the muscle to return to its normal state should be at least 2 to 3 times longer than the pulse duration. And another current method that's used in denervated muscle electrical stimulation, progressive exponential currents. Progressive exponential currents is used for diagnostic purposes in stimulating the denervated muscle. The impulse duration should be as short as possible while still long enough to effectively stimulate the muscle. And it's important to achieve an appropriate level of contraction without causing unnecessary discomfort. The length of the pause between stimuli should be at least 4 to 5 times longer than the stimulus duration. And as a result of our chapter, we can say that the nervated muscles can be prevented from atrophy with electrical stimulation, and atrophied muscles can be redeveloped and healed, and that electrical stimulation that starts in the early period after the nervation has positive effect on the prognosis. So we can choose any electrical stimulation type. If you want surge Faraday, galvanic stimulation, or any waveform, triangular, rectangular. It depends on the patient's tolerance, and it depends on the muscle formation. But we know that even in long-term degenerative muscles, we can try the electrical stimulation, because studies showed that the long-term electrical degenerated muscles can give response to electrical stimulation. But we need more standardized methods and devices for degenerated muscle stimulation. And so we need more studies and projects in this subject. And these are our project partners. Thank you for listening.